Hi everyone, my name is Loretta Nota. I'll be going over the rotavirus vaccine today. I'll be going over what rotavirus is and the two vaccines available and all of the symptoms that go along with rota. Okay, so starting off, what is rotavirus? It's a very contagious virus that causes diarrhea and other symptoms. When looking at it through a microscope, you can tell how it got its name with its round, circular shape. Fun fact, the Latin word for wheel is rota. Rotavirus, as seen here, causes more than 125 million cases of diarrhea each year in children and infants worldwide. In the United States, the number of childhood deaths is between 20 to 40 each year and about 600,000 worldwide. Populations most affected are infants and young children, but close relatives and those who work with children can also be affected. Rotavirus is typically spread through families, hospitals, and child care centers. It is shed through stool and can survive on objects for several days. So, while good hygiene and environmental cleanliness is very important, it won't stop the spread of this virus. Some symptoms to keep an eye out for that will most likely show up 2 to 5 days after contact are vomiting, fever, and stomach pain. Those typically last between 3 to 5 days. After those first 3 symptoms have subsided, there is a severe diarrhea that can follow and develop and hang around for 5 to 7 days. Because of all of these symptoms, there is a high risk of dehydration that can happen, so you want to make sure that you're replacing all those minerals that may be lost. Some emergency signals to keep an eye out for are lethargy, frequent vomiting, less desires to drink fluids, black or bloody stools, and of course the biggest red flag is the high fever that lasts for more than 24 hours in a young infant or child. So, when looking at diagnosis, a doctor will base a diagnosis on a physical exam and ask questions about symptoms. For some cases, lab analysis of the child's poop can also be used. For treatment, while there's no cure for rotavirus because antibiotics and antiviral drugs don't help, there are 2 vaccines currently available to help prevent infection. These 2 vaccines that are available are going to be Rotatech and Rotarix. Both of these should be administered before 15 weeks of age, and all doses should be received by 8 months. Going over the first one, Rotatech is given in 3 doses at ages 2, 4, and 6 months. Rotatech is also known as RV5, and it was approved in 2006. It has a 98% protection rate, so it's also the highly recommended one. The next vaccine, which is Rotarix, was approved in 2008, is also known as the RV1 vaccine. This one is only given in 2 doses at 2 and 4 months of age, and it has showed an 85% effectiveness rate. So looking at how these both work, the vaccine contains a live human rotavirus that has been weakened or attenuated. By using this, we are stimulating adaptive immunity by allowing our cells to figure out what's going on and recognize the antigens of the rotavirus so that we can later in life be protected against it as well too. With that in mind, because of the timestamps that are needed for these doses, it should not be given to those who are clinically immunosuppressed because the vaccine strain could replicate and cause serious infection. The biggest question that happens is, are these vaccines safe? Yes, for the most part, but there is always a small chance of developing side effects from any medication taken. There is a very, very tiny chance of developing intussusception, especially if the vaccine is given later than recommended. Intussusception is when part of the bowel folds in on itself, creating a blockage. This can be very life-threatening if not treated quickly and usually requires surgery to fix it. I read about that most infants or small children that have gone through surgery have recovered pretty well and are back to normal in no time. So with that being said, our next page is the end. So I hope you all stay safe, wash your hands, make sure to disinfect your surfaces, and make sure to get vaccinated.